So which ethical principle was violated in this case? So this question is general about adherence. Okay. So adherence in general is beneficious. Adherence in general, when we say it in general, it's beneficious. In general, if they become more specific and they talk about late and early, then it becomes more specific. But generally speaking, adherence is beneficious. But if the question says patient comes for late refill of his medication and you counsel on the late refill, why do you counsel on the late refill? What's the concern of late refill? If I take blood pressure medication and I come for late refill, what's the concern? The blood pressure will not be controlled. So when you tell me that I have to take the blood pressure medication as prescribed, then you are applying beneficence. Again, this is beneficence. When we tell the patient take the blood pressure medication as prescribed, we are doing this to control the blood pressure. That is beneficent, not to prevent heart attack. Preventing heart attack will come by controlling the blood pressure. So beneficence first. And if we say it's early refill, patient keeps coming for early refill. What is the concern? Why when a patient keeps coming for early refill, you tell the patient you need to take the medication as prescribed? What is the problem with the early refill? Overdose, abuse. So in this case, when you tell the patient who comes for early refill medication all the time to take it as prescribed, this is non-beneficious. So beneficial adherence in general is beneficious. If it becomes late refill and you have a concern that the patient's condition is not controlled, if it's late refill and you have a concern that the patient's condition is not controlled, then this is beneficial. If you have a concern, if it's an early refill and you have a concern of abuse or overdose, then this becomes non-beneficious. So beneficence, adherence in general, beneficence. If it's late refill and you are concerned about uncontrolled medical condition, it becomes beneficence. If it's early refill and you are concerned about adherence, it is non-beneficence. Is it okay that you give up? Is the pharmacist here doing something right when he says, you know what, I keep telling you, and you never listen to me, so you know what, I'm not going to talk to you about this anymore? Is this, generally speaking, acceptable? Well, there is something that we call futility. You don't need to worry too much about this, but there's something that we call futility. What is futility? Futility is when you give up. In medicine, this is when you give up. So apparently this pharmacist reached futility. So futility, like if you want to give it, and I don't think you need to know the definition. It's when you, I will just type it. This is the definition of futility. You don't need to worry about it. It's just a term. When you believe that more intervention will not produce any outcome. Do we do this? Yes. In cancer therapy, at a certain point, the physician may go to the family and say, you know what? There is no point. There is no point to continue treatment. There is no point to give chemo. Let's just stop all the treatment. Why? It will not work. We call this point futility. Futility, if you believe that, you know what? I'm done. Like, it doesn't matter what we do next. So this pharmacist here reached futility. I keep telling you take the drug. I keep telling you take the drug. I keep telling you take the drug, and you never listen to me. So I will not keep telling you if there is no outcome. So good luck. That's what we call futility. And we do reach futility in medicine when we believe that further intervention will not lead to any more outcome. Patient has diabetic foot and they keep giving antibiotics. At a certain point, they may say to the patient, you know what? We have no other option but amputation. Case number 6. Which ethical principles are in conflict in this case? In this case, we have, of course, confidentiality, and we have non-malfeasance. No, non-malfeasance, drug-drug interactions in general are considered harm. Most of them. 99% of the drug-drug interactions are considered harm. So the pharmacist here is concerned about confidentiality. Should I speak about the drug-drug interaction and break the confidentiality, or should I maintain the confidentiality and discuss the harm because of the drug-drug interaction? Drug-drug interactions in general are considered harm, except very minor situations when one drug is taken to boost the effect of the other. That's when drug-drug interaction can become beneficial. If you take 2 drugs, one of them increases the effect of the other. Like, for example, in HIV, when we give this ritonavir boosted therapy, yeah, then ritonavir here is to increase the effect. That's when drug-drug interaction can become beneficial. But generally speaking, drug-drug interaction is, in most cases, harm, non-beneficial. So which ethical principles are in conflict in this case? Confidentiality. Should I maintain the confidentiality of this girl, but then she would be at risk of drug-drug interaction? Or should I try to prevent the drug-drug interaction, but I have to break the confidentiality and tell the father, by the way, your daughter takes birth control? How should I handle this situation in general? You can. Auxiliary labels can, yeah. But usually auxiliary labels goes on the birth control, not on the antibiotic. When you say this for birth control, we put an auxiliary label that says antibiotic may reduce the effect. So we can put it also. Yeah, why not? So what do we do? Well, we need to speak to this girl. We need to speak to this girl. That's for sure. We need to talk to the girl. We can call the home and things like that. Can I ask the father to bring her? Don't do anything that's alarming. When you tell the father, I need your 14-year-old daughter to come here. Okay, yeah, she's in the car. Let me get her. You go and get her from the car. And then, okay, now what? Now what? She's standing there with her father. Now what? Right? Like, you told him, bring your daughter, and he's like, oh yeah, she's in the car. Let me get her. And then they come, both of them, and stand in front of you. It's the same problem, right? So take her to the counseling room. That's alarming too. When you tell the father, I'm sorry, I need to speak to your daughter privately. Why? She's 14. She's underage. I'm a custodian. So don't do anything that's alarming. And that's why we didn't tell the lady go and get tested. Because go and get tested was alarming. Something wrong is going on. So when you act in a certain way with the father, that in a way or another tells the father there's something I'm trying to hide from you, then the father will be alarmed. What about calling the physician to discuss this? Why would you call it? Like, what are you expecting the physician to do? To change the antibiotic to something else? All the antibiotics, in a theory, interact with birth control. So you're not really, you'll go back to the same problem again. But if there's a drug that can avoid the interaction, yes, of course you can. But there's nothing in this case. There's nothing that we can avoid. And also, please keep in mind, when there's a drug to avoid the drug interaction, it has to be as good as the one that you need to give. Like, you can't just recommend a third-line agent to avoid a drug-drug interaction for a case like this. No. So we need to be mindful of the change. In this case, because it's birth control and antibiotic, there is no much to do avoiding drug-drug interaction. The best way is we will dispense the drug, counsel the father with the antibiotic, and then I can tell the father, you know what, if you don't mind, I need to follow up with your daughter. I can call your doctor tomorrow to make sure that she's taking the drug and everything's fine. Sure, yeah. Then I plan to speak with the daughter. And then I counsel the daughter on this issue. Okay, we can put a label on the vial. We can, but label on the vial does not replace counseling. Auxiliary labels, Poonam, are good, but they do not replace counseling. So you can't put the label on the vial that says this medication interacts with birth controls, and then you're like, okay, well, I did my job. No, it doesn't replace counseling. So we've got some answers here. Contacting the physician, not in this case, because we don't have another first choice that will not interact. Put a label on the vial, nice, but does not replace counseling. Okay, ask the father to bring the daughter here, sure, but it doesn't necessarily mean that we will not be in the same situation again. Okay, and we delay the dispensing and call the girl? No, because at the end of the day, you will, again, how long you delay the dispensing? Right? But no, I would dispense the drug and make sure I call later today or tomorrow. And you can label the call for making sure that the symptoms improve, making sure fever subsides, things like that. So I would not necessarily, Adnan, delay the dispensing to call the girl. I would not necessarily do this. What about general counseling? What about general counseling? What does it mean, general counseling? When the father is there, just tell the father, by the way, this drug may interact with birth control. So if your daughter is taking birth control, she has to be careful, use barrier method and things like that. How do you think about general counseling here? Correct. Okay, so now, general counseling is not enough. Why? The father will not tell the daughter. Why? Because she's not taking birth control. He doesn't know this. If I come to you in a pharmacy to fill a prescription for metronidazole for my wife, and you tell me your wife has to stop drinking while taking metronidazole, and I know as a matter of fact that my wife doesn't drink, I will not go to my wife and say, oh, by the way, the pharmacist tells you don't drink. I know she doesn't drink. Why would I communicate this message if I know it doesn't exist? So when you tell the father, by the way, this antibiotic may decrease the effect of birth control methods, so if your daughter is taking any birth control method, your daughter will need to use a backup method. The father will be like, is this pharmacist crazy? My daughter is 14. No way she takes birth control. Okay, he will not communicate the message. He will not communicate the message. When will the general counseling work? When will general counseling work? If the daughter is here. So all I said, tell him to bring her. Sure. So now the daughter is in the pharmacy with her father. I will not tell them, okay, sorry, I will need to speak to your daughter privately. This will be alarming. But what I can do if the daughter is there is I can provide general counseling and say, this may or may not apply to you. That's what I will say. This drug is called, you take it this way, this is the effect, these are the side effects. One more thing, this may or may not apply to you, but antibiotics may reduce the effect of the birth control pill. So if you are using any, if you are using any birth control pills, make sure you use a barrier. And then the father goes, oh, does my daughter take birth control? No. This is general counseling we have to provide to all females of childbearing ages who are using antibiotic. And as I said, I don't know. It may or may not apply to you. So I don't know if you're taking birth control or no. So that's how we will handle the situation. I need to speak to this daughter. And the great thing is we got some examples of other options, and we saw why these options may not be the best in this case. Next one. Can an email correspondent to the daughter help to communicate on the interaction? Very nice. That's a new one. Well, it can, but what about confidentiality? Are you sure that are you sure that no one else will check the email? No one else will see the email? Something like that. So I would be careful. But the idea itself is very brilliant. Yeah, but you are sending this email to the girl, so it's the same thing. What if the lady takes the medication before you get to speak with her and suffers the bad effects? Okay. First of all, we will not wait until the treatment is completed to call the lady, to call the girl, the 14 years old in this case. This is number one. Number two is there's an option we have. So even if the girl I call her tomorrow and she says, oh, I wish you called me yesterday because there was a relation, then she can take plan B, and this will also do the job. So what if with that general counseling it triggers a question and pharmacist asks if the daughter takes birth control? Then the answer will be no. That's a general counseling that we provide to all ladies of female child age who take antibiotic. It's a general counseling, and that's why we start by saying this may or may not apply to you if you take a birth control, which means I don't know. Yeah, we answered the question about Charles about this. So we said that even if the girl has an intercourse, she can take plan B, and we're not waiting until the treatment is completed. We will call the lady tonight or tomorrow. So this case number 7, how do you feel about this? Fidelity, altruism, beneficence, non-beneficence. So let's always, when we answer ethics question, what do? We analyze the case, bring the case to level 0. Bring the case to the baseline. What is the problem in this case? Our pharmacy is getting more prescriptions and we are short staff. So the pharmacy is very busy. Great. We told the manager, hire more staff. The manager said no. Now, when the pharmacy is very busy, what is the concern? Is our concern that we don't take lunch break? The concern is errors. That's it. See, when you analyze ethics case and bring them all the way to the baseline, answers come very clear. So this is a case of non-malfeasance. We can put patients at risk by causing errors. That's our concern. So which ethical principle does the pharmacy owner violate in this case? It is non-malfeasance, because the excessive workload can increase the chance of errors, and errors can put patients at risk. What about fidelity? There is nothing specific about fidelity and workload. Fidelity has to do maybe with, again, fidelity has to do with the trust. When I go to the pharmacy, I trust that they give me the right drug. Right? So I don't care how many staff are working behind the counter as long as they give me the right medication. So this is primarily non-malfeasance, because we know that workload increases the chance of errors. Beneficence too, because pharmacist may be rushing to finish all he has to do and asking some essential service and skip some essential service to the patient. Well, that's no. So he says, for example, pharmacist will counsel the patient quickly. Workload is not associated with less counseling. Workload is associated with that's what we know from studies. Workload is associated with errors. with errors. When the pharmacist is extremely busy, this is associated with errors. It is not a reason for the pharmacist to skip counseling. It is not a reason for the pharmacist to skip counseling. Fairness and justice apply to patients. Can it apply to staff? Not necessarily. Nothing specifically that says pharmacy manager. If the pharmacy manager keeps the staff busy, this is violating the staff well-being. I don't think this has anything to do with ethics. Like, yeah, this can be with the human resources, with the management, but not ethics. Our obligation, our ethical obligations toward our patients. 8. Can autonomy apply to staff? Yeah, but remember, autonomy applies when you have a choice. Correct? So if I go to my manager today and I say I need a raise, and my manager says no, there's no raise, should I cry and say you violate my autonomy? Would be nice, right? Correct? Asking for a raise is nice, but when the manager says no, this does not violate autonomy. I have the right to ask, but also the manager has the right to refuse. So no, I wouldn't see autonomy. When you go to the manager and say we need to hire more staff, this doesn't mean if the pharmacy manager says no, is violating my autonomy, because I don't have the choice to hire more staff or to say no. Problem-solving mode is activated when there's a low. Yeah, sure. Yeah, but the studies have shown that also workload is the main reason for dispensing error. Yes, of course. We will discuss this in error prevention. Correct. But generally speaking, we know that number one reason for errors in the community pharmacy in studies was workload. That's what pharmacists said. Some controversy about this, yeah, sure, but that's a different story. Next one. So this is autonomy. Which ethical principle is violated is autonomy. Where is autonomy? The patients want to take a drug. Just a second. I thought you said autonomy has legal limits. Yeah, but this is a non-prescription drug. This is a non-prescription drug. So taking this drug or not taking this drug is indeed autonomy. Because now, when the pharmacist will leave this patient and say, well, you don't need anything, have a nice day, what the patient will do? Take all the drugs and go home. Take all the cold remedies or cough medications and go home. So basically, patient's autonomy here is the one in the question. You should give the patient something. The patient won't cold remedy. So what should I do in this case? Advise the patient, sir, you don't need any medication. No, I need something. Believe me, go home and drink water and you'll be fine. No, I need something. Okay, then don't leave the patient to pick something by himself. You pick something and tell the patient, well, I explained to you that you don't need any medication. But if you want to take something, take this. Now I'm making sure the patient will not take something that harms him. So I'm doing the right way now. So let me ask you a question. Which ethical principle does the pharmacist uphold in this case? Uphold by telling the patient, you know what, I'm ethically against giving you something that you don't need. I believe that's fidelity. I believe that's fidelity. In this case, what's your change there? No, no. I'm saying if the question is which ethical principle does the pharmacist uphold? Sorry? When he didn't give, yeah. When he said no. Like, what is the pharmacist upholding by saying, you know what, I'm against giving you something when you don't need it? That's fidelity. When the patient comes to you and the patient says, I need something, and you tell the patient, you know what, you don't need anything. Indeed, you are maintaining this trust because I can sell you something. Imagine you go to any store, okay, and that's in our real life. You go to any store to buy, you go to a store to buy a TV. And when you pick a TV that's $1,000 price and you go to buy this TV, the staff in the store tells you, oh, by the way, don't buy this TV. People bring it back to us and it malfunctions after a month or two. Don't buy it. There's one that's for $400 that's much cheaper and it's much better. Right away, you want to kiss the staff. Like, you have this much of trust. You will trust him. Why? Because now you're sure that this staff is not trying to financially benefit from you. You would appreciate that. So the fact that the pharmacist says, you know what, believe me, you don't need it. I don't want to give you something. I can easily tell you to buy something that's for $20. But why would you pay money for something that you don't need? That is fidelity. That is fidelity. You are applying fidelity. But you are going against the patient wish to get something on prescription because the patient can get it anyway. If it's not from you, it's from someone else. It is not a prescription drug. So that's what I would do. If the question says which ethical principle does the pharmacist uphold in this case, the pharmacist is upholding fidelity by not giving the patient anything that the patient doesn't need. What of veracity? No, there's no veracity in this case. Veracity is to tell the truth when truth is due. That's when veracity is. That's when there's no veracity here. There's no point in the case when the pharmacist is expected to provide information or to lie or something like that. There's nothing in the case about this. This is a case about drug recommendation. Okay? What term is used to describe the pharmacist's behavior? Saying, you know what? That's it. Have a nice day. We call this paternalism. And please remember, paternalism is not an ethical principle. Is not. It's a behavior. So please, in the exam, if you get a case that says which of the following ethical principle the pharmacist uphold, ethical principle, uphold, never choose paternalism. Paternalism is not an ethical principle. Paternalism is the opposite of autonomy. It's the opposite of autonomy. It is not an ethical principle. So the question says which of the following ethical principle the pharmacist uphold, it is not paternalism. Paternalism is when you force your opinion on the patient. That's what paternalism is. If the pharmacist insists on not recommending any unnecessary medication, is he in trouble? No. That's good. If the pharmacist refuses to recommend something when it's not needed, that's good. Defensive medicine, is this defensive medicine? No. Defensive medicine is when you are afraid of liability. You are afraid that the patient will go and complain. And this patient can't complain. When you tell the patient, you don't need the drug, go home and just drink lots of fluids and you'll be fine. And then the patient insists. And I tell the patient, okay, you know what, I will give you something. I'm actually doing this to make sure the patient will not harm himself by choosing the wrong drug. But I don't think this is defensive medicine because my concern here is not liability. It's not like, okay, well, the patient complains to the college, I will be in trouble. No, I will not be in trouble. Actually, the college can say, thank you for doing this because you don't recommend something that the patient doesn't need. Is fidelity here meaning loyalty to the patient? Fidelity always means loyalty to the patient. That's what fidelity is, loyalty to the patient. Why not conscientious decision? Conscientious decision is when you refuse to offer a service based on your religious background and your moral background and your cultural background. This is not, you will give the medication to this patient. You said to this patient, no, I will not recommend. But for another patient, you will say, oh yeah, here you go, that's the drug. So you are not refusing the service. You have no problem with the service. So this is not conscientious decision. Conscientious objection is when you refuse a service for all the patients based on your religious background and cultural background and moral values. Number one, this case has no religious background or professional or religious or moral values or culture. This is about professional judgment. Number two, you are not rejecting the service for all the patients. You are making decisions based on the patient's condition. So you can't say that's conscientious objection. That's great. I like the questions that make us discuss it, because for sure some people will have this in their mind. So we need to make sure it's not, it's nice to know the answer, but it's also nice to understand why the others are not answers. So this way you can think this way in the exam. If paternalism is not an option in the answer, is it fidelity? No, it is not fidelity. Fidelity is an ethical principle. So the question will not be what term is used to describe the pharmacist's behavior. The question will be, Rohma, the question will be, which ethical principle does the pharmacist uphold? Or it can be, which of the following ethical background is the base of the pharmacist's decision? Then it is fidelity. I know ethics cases are always thought-provoking and we have lots of disagreeing, and I am confident 100%, and that's absolutely fine, that some of the friends who are listening to this and having this discussion in their mind, oh, this is nonsense, I'm not going to listen to this guy. You have the right to, of course, but I'm just saying that, like, it's up to you. I am confident some people are like sitting on the other side of this class and they're like, this doesn't make too much sense to me, I'm not going to listen to this. Sure, that's your choice. Next case. We came at 2 right here. So that's a straightforward one, right? This is fidelity. We always agree on number 9. This is a pharmacist who's only loyal to his bank account. 10. So what these symptoms suggest? These symptoms, of course, suggest elderly abuse. What ethical values in conflict in this case? And the ethical values here talks about, I don't want to talk to you. I don't want to talk to you versus my concern. So this is autonomy. Patient doesn't want to talk. And protecting vulnerable or non-malfeasance. But protecting vulnerable is a better choice. Protecting vulnerable because elderly abuse is protecting vulnerable. Elderly can be so weak and they can't defend themselves. So they are vulnerable. So that's why protecting vulnerable is the best choice. And then it's autonomy when it comes to the patient telling you, you know what, I'm not here to discuss my personal matters with you. I don't want to talk. What other steps should the pharmacist take in this case? We already mentioned that, right? Oh, so should the pharmacist respect Mr. Smith's privacy? No, because Mr. Smith may be too scared to discuss it. You never know. Maybe Mr. Smith is threatened at home and too scared to even talk about it. So we can say his statements, you know what, I don't want to talk here, as a no. What other steps should the pharmacist take in this case? First, you need to understand the human approach first. So in this case, I spoke to Mr. Smith. Mr. Smith refused to talk to me. Then what I can do is I can talk to his son and share my concern. I will share it in a respectful way. I'm not calling the son and say, are you abusing your father? No. I will call the son and say, you know what? I noticed 1, 2, 3 on your father. So is everything going okay? And then I keep monitoring. If the problem continues and I believe there's abuse going on, I report. What if the son, when I call the son is like, oh, this is not your business. And the next day, all the prescriptions are transferred somewhere else. Then you have to report. So if the son tells me, you know what, this is not your business to talk to me about my father, this way, I appreciate your concern, but I'm not going to talk to you. And then next day, another pharmacist is calling you to get all the prescriptions transferred. Then I have to report. I have to report. Something wrong is going on. So I have to report. And remember, reporting doesn't mean there's abuse. Like if the police investigates and they find everything is okay, then you are not like liable. You did your job. So don't be scared to report. So what other steps the pharmacist should take? Number 1 is speak to the son about this and keep monitoring. If the problem continues, or if you notice that the son is trying to cover this by transferring the prescriptions elsewhere, then you have to report. When do you need to report? Immediately, if you have a concern about immediate harm. So you see something, you are in the parking lot, and you see the son mistreating the father, and you're like concerned about then you report immediately to the police. What other situations when you have a conflict of these principles? As we said before, all of these ones on the slide here, all the protecting vulnerable ones. So if you go back all the way, these ones. So you can break confidentiality if the patient is at risk. You can break confidentiality, and even if the patient tells you I don't want to talk, if there's sexual abuse, in case of child abuse, in case of incompetent and incapacitated members. So in these cases, when someone tells you I don't want to talk, I don't care. Patient, you believe the patient is victim of sexual abuse, and the patient says, you know what, I don't want you to tell anyone. I don't care. If you have a colleague in the pharmacy who has depression and it's severe and it's affecting the public, I wouldn't care about privacy in this case. I'm protecting the public. So these are situations when we may break confidentiality to protect others. Does reporting put the pharmacist in danger? As long as you have good documentation of your reasons, so you're not just making a claim that there's abuse going on, then you shouldn't have any concern. You shouldn't have any concern as long as you have reasons and you document everything. So why do you think there's abuse in this case? What makes you think this way? What evidence do you have? The bruises on January 29, because by the time you report that the bruise may be gone, so you document everything. I mean, from the person you told about, oh, that's a different story. So you're afraid the son will come to the pharmacy and shoot you, kind of thing. Yeah, well, unfortunately, there is no guarantee that this doesn't happen in pharmacy. I'm sorry, I mean it. Like, we do lots of things in the pharmacy that may not make patients happy. Will I be worried that someone will come and retaliate? I'm like, then exactly. You tell a methadone patient, I don't have a dose for you, and then the methadone patient gets a gun and shoots you. For example, I'm not saying anything. I don't mean it in a disrespectful way, but I'm just discussing your question. Then we will not do anything in the pharmacy. We will be like open access place. Anyone comes and like, okay, sure, whatever you want. Yeah, no, I wouldn't worry too much about this. Are you guys okay online? We're okay. Voice, everything's good. Good. I know ethics is always lots of thinking. Okay, good. I just want to make sure everyone is. Yeah, people in class, I keep staring at them so they can't fall asleep. Just about online people. Number 11. Does all this need to inform pharmacy manager before reporting? Of course. You know, informing the pharmacy manager, first of all, in a case of elderly abuse, you can discuss this with the pharmacy manager, but at the same time, this doesn't relieve you from your obligation to report because you are the one who monitors the symptoms. So you don't just go to the pharmacy manager and say, oh, by the way, I noticed this to Mr. Smith, and then you leave it up to the pharmacy manager to report. It is not the responsibility of the pharmacy manager to report. It's the responsibility of all of us. But because I'm the one who saw this, I'm the one who have concern, I'm the one who documented my observations, then you can talk to the pharmacy manager, but this doesn't release you from your responsibility to report. This is an easy one. We never have a problem with this. The drug review committee in the hospital as a new drug with a proven efficacy and remove a drug that has increased risk of hepatitis. So what ethical values did the committee observe when they added the first drug? So this is, for the first drug, it is beneficence, and for the second drug, it is non-beneficence. Reporting elderly abuse is always to the police, right? Number 12. Beneficence. Why do we call, why? Because the mother said that I can swallow the capsules. Okay, so why do you want the guy to swallow the medication? To get the benefit. So that's beneficence. Again, always, and this is always a challenge in ethics cases, is when someone will say that's not beneficence. Why? Because the child may choke on the capsules. Yeah, well, the mother said he can't swallow, so I am afraid we'll choke on the capsule. Yeah, well, again, that's not our primary problem. This is not what's in our mind. When the mother said can't swallow the capsules, my concern is I want him to swallow the capsule. I want him to swallow the medication. So my primary concern here is beneficence. Unless the question says clearly that this child had long history of choking on medications, and then you are concerned about this. Oh yeah, that's not beneficence. That's not beneficence. But when you look at this question as is, I have a child who has a prescription for medication and is not able to swallow it. I need the child to swallow it to get the benefit of the medication. Okay? Altruism, as we said at the beginning, one of the ethical principles that I notice that people overuse it. Altruism is when you go above and beyond your job. This is not above or beyond. This is not above and beyond. This is your normal job. Your normal job is to make sure your patient can take the drug. That's the case. So there is no altruism here. You are not doing something exceptional for this patient. No, it is our job to change the drugs all the time. So there is no altruism in this case. Can autonomy apply? Because pharmacists give another available formulation. And where's the autonomy here? Like, okay, well, where is the autonomy? If the mother tells me, can you please switch this to liquid? So if the mother comes and say, is this prescription for capsules? Yes, it is for capsules. Oh, is it possible to call the doctor to switch it to liquid because my son can't swallow? Of course I can. Yeah, that's autonomy. That's autonomy. But when I suggest to give liquid, my concern for giving the liquid is I want the child to be able to take the medication. So here I am applying beneficence. In making this kind of dosage form adaptation or change, do we need to inform the prescriber? Well, this depends on the case. So generally speaking, according to all the expanded scope practice, as we'll discuss in Unit 3, you don't need to. Next one. So this is Grasti. What about beneficence? Grasti, because you are clearly telling the patient, this is your medication, it's called this, it works this way, you should feel some benefit in this days. So basically, you knowingly providing wrong information to the patient. Well, yes, the patient is expecting you that you may provide wrong information, but you are providing wrong information. What about beneficence? Is this violation of beneficence? What about beneficence? Are we here violating beneficence because the patient is getting placebo? No, it is not. For two reasons. Number one, the patient accepted to take the placebo. This is number one. Number two, we don't use placebo in clinical trials unless it has evidence. We don't use placebo in clinical trials unless it has evidence. And we cannot put the patient at risk by using placebo. So you will never find the clinical trial comparing ramipril to placebo in management of hypertension. It can't. Why? Because the group that has high blood pressure and they take placebo, good luck. It can't. So there's no concern of beneficence here. What about autonomy? There's no concern of autonomy because these patients accepted to participate in the clinical trial. You can't put someone in a clinical trial without he or she knows that I am participating in this clinical trial. So we don't have any concern of autonomy here. Still veracity because the patient does it, like it's you who provided wrong information. You gave the patient a bottle that contains no medication and you provided the patient as if the patient is taking the drug. You are the one who gave information that is not true. Yes, the patient is expecting you to always counsel on the drug, but the fact is you knowingly are giving the patient wrong information because what's in the bottle is not the active drug. If in this case it's a triple blind, what do you mean by triple blind? Triple blind has nothing to do with the pharmacist. Triple blind means the patient doesn't know, the physician doesn't know, and the statistician doesn't know. The one who's doing the statistics. So we have nothing to do with this. What is the best way to disclose? This is an important question. What is the best way to disclose adverse reactions of investigational drugs during trials to patients? What is the best way to disclose the information about adverse reactions of investigational drugs during clinical trial to make sure that there is no liability afterward? To include this on the consent, not just to get them to not to tell the patient verbally and then get them to sign. No, make sure that these side effects are documented on the consent. So when the patient signs, I am participating in the trial, it is written there, I know that I may experience these side effects. That's what we do in the pharmacy when we give the injection, the vaccines. When we give the vaccines, it is documented on the consent that the patient signs that after the vaccine you may experience pain, redness, irritation at the injection site, fever, etc. So that's the best way. Whenever you want to make sure that you release yourself from liability, include the side effects on what the patient signs. So if the patient is participating in a clinical trial and the patient will take a drug that's investigational, it's very important to include the side effect that the patient experience on the consent form. Tell them what to expect before the trial, exactly, and get them to sign that that's they accepted to participate, even though that's what we expect. 14. So this is non-malfeasance. This is non-malfeasance. Why? Because red flags cover serious side effects or serious problems. So when you give the medication that's intact without asking about the red flags, you are putting the patient at risk. That's what it is. Red flags are symptoms that suggest that the case is not as simple. Patient comes and say, I have heartburn. Having black stool is a red flag because it suggests that the patient may be bleeding from the side. So you are giving Zantac to someone bleeding from the side, you are masking the bleeding. And the patient can get, the condition can deteriorate. Is it veracity as well? Okay. First, this is not about telling. This is about asking. We forgot to ask about red flags. So there's no veracity here. Veracity is when you provide wrong information. But here, you didn't even provide. You forgot to ask. You forgot to ask. So there's no veracity in this case. 15. So generally speaking, when the pharmacist participates in something like this, generally speaking, something for the benefit of the whole community, this is beneficence. This is beneficence. Pharmacist participates in a smoking cessation program for the community. That's beneficence. Pharmacist participates in safe sex education. That's beneficence. Pharmacist participates in sharp collection program. Sharp collection program. This is beneficence. When you participate in something for the benefit of the community or to protect the whole community, this is beneficence. That's a good point. So wouldn't this be also altruism? It can be like the fact that the pharmacist is going above and beyond. This can be also upholding altruism because the pharmacist here is volunteering, dedicating time and effort to do something for the community. No one is asking the pharmacist to do this. No one will pay the pharmacist to do this. So this can be seen as altruism, going above and beyond your responsibility. Primarily, it is beneficence. You are doing this for the purpose of the community, but also you are demonstrating altruism. That's a good point. Yes. So altruism would also work here, but primarily it is beneficence. If the pharmacist practice this in his pharmacy, charging money to the patient for the service, charging money to the patient for the service. So you are collecting, you are doing, you are counseling on safe sex practice, and you get money. I mean, that's a service. I don't see any ethical issues in this. Like there's nothing you violate and nothing you uphold. You are offering a service. You are supposed to do it right, and that's it. It's a service. It's like private clinic. When a patient comes and say, I'm traveling, what do you recommend? And they say, take Dukoral. I counsel on the Dukoral and they take the money. You know, like recommending the Dukoral can be seen as I'm educating the patient on harm prevention, but at the same time, it's not like I'm giving it for free. I'm actually getting the fee for the service. So I don't see any ethical complications in this as long as I recommend the right drug or I recommend the right intervention. So case number 16. So what ethical values are in conflict in this case? So we got autonomy and beneficence. We got autonomy and non-beneficence. So the autonomy, this case, when you think about it, it is actually about the pharmacist. You as a pharmacist in this case, you are torn between two things. You as a pharmacist, you have two problems. You have two ideas fighting in your brain. Idea number one, should I give him the drug so he can sleep? Beneficence. Or should I say no to make sure he's not abusing it? Non-malfeasance. So as a pharmacist, I have two fighting ideas in my mind. Should I give the drug to sleep? Beneficence. Or should I say no to prevent abuse? Non-malfeasance. So the answer for this is beneficence and non-malfeasance. What about autonomy? Am I here violating autonomy? Am I here violating autonomy? Remember, autonomy has limits. When a patient comes to the pharmacy and say, I need my medication early, and I tell the patient, I'm sorry, sir, I cannot release it early, I am not violating his autonomy. Autonomy applies when the patient has the right to say yes or no. When autonomy applies, if this patient is coming to the pharmacy today to fill his Ramipril, and then I notice that he didn't take lorazepam for a few days, it's late. It's late to fill lorazepam, or it's due today. And then I ask the patient, sir, do you want me to fill your lorazepam? And he says, yes, fill it. Or no, don't fill it. That's autonomy. Why does it apply? Because the patient here is due to take the drug. Taking the drug or saying no, it's up to him. But if you start thinking about this, patient comes to you and say, I need my morphine early. If I say no, the patient calls the college and say, this pharmacist is violating my autonomy. There's no autonomy. Autonomy applies when you are in a situation that allows you to say yes and no, do and don't. Patient takes a medication from you, and the patient comes after 5 days saying, I have been using this for 5 days. Please take the drug back and give me my money. I say no. I am violating his autonomy. By saying no, I'm not giving you the money because I already dispensed the drug. Am I violating the autonomy? No, that's not violation of autonomy. So autonomy has limits. Autonomy applies when the patient has the right to say, sure, let's do this, or no, please don't do it. But this doesn't apply in this case. So there's no place here for autonomy. What ethical value did the other pharmacists violate when they did not discuss the early refill with the patient in the past? The ethics conflict in the case related to refusing by the pharmacy or approved by the dispensary of the manager. Well, the manager did not approve it. The manager just said, you know what, give the drug, please. So the pharmacy manager is like didn't come and elbow the pharmacist and give the drug and let the patient go. No, the pharmacy manager is just suggesting something. But if you want to include the pharmacy manager, we'll see this in the last one. So this is non-malfeasance. Of course, why? Because that's early refill. Early refill is concern of abuse. So when other pharmacists saw the early refill being recurrent and they decided we don't want to talk about it, they are basically violating non-malfeasance because they should have intervened. Next one, which ethical principle does the pharmacy manager uphold? Well, the pharmacy manager upholds fidelity because the whole conversation, the pharmacy manager's standpoint in this case is what? Loyalty. Loyalty. The pharmacy manager's standpoint is loyalty. The pharmacy manager, for example, didn't come to the pharmacist and say, you know what, Mr. Craig will have a big problem sleeping, so please give him the drug. Yeah, this would be beneficence. But he didn't come from this point. He said, he's our customer for a long time. Let's make him happy. Give him the drug. Yeah, that's fidelity. I want to maintain this loyal relationship with my patient. So that is fidelity. Which ethical principle does the pharmacy manager uphold? Mainly fidelity. Wants to maintain this loyal relationship with the patient. Is it beneficence? There's nothing in the pharmacy manager statement suggesting that it's about the drug, but it's all about long-time customer. So that is fidelity. Again, this is not autonomy because there is no autonomy in the case. So the pharmacy manager is not upholding the patient's autonomy. There is no autonomy in the case. Filling the drug early, saying no to this is not violation of autonomy. So there's no autonomy here. Question. Does the pharmacy manager here violate justice? Question here. Does the pharmacy manager violate justice? How is it the best interest? It's not the best interest. It is the pharmacy manager here, Chintan, is trying to maintain the reality. Trying to please the patient, to reward his long-term relation with the pharmacist. So this is about fidelity. It's not best interest here fidelity has lots of meanings. Doing whatever the best for your patient is fidelity. Maintaining the patient trust is fidelity. Being loyal to your patient, which is the case here, is fidelity. So is justice here violated? Okay. Is justice here violated? No, it is not. Why it's not? Where do you see the discrimination in this case? Where's the discrimination? Where did you see differential treatment? Where did you see other patients treated differently in the case? Okay, one patient is allowed early refill and others are not. Where did you see the not? Where in the case did it say that others are not allowed to have early refills? There's nothing that tells you this. He mentioned this is a VIP. So what? Sometimes you go to a store for the first time ever. You go to the store and someone stops you and say, sir, because you are a VIP customer, can I offer you a Visa card? And VIP customer, what? I have never been to this store before. What are you talking about? So saying VIP doesn't necessarily mean VIP. It's a language that we use to please customers. And his VIP refers to being long-time customer. So don't choose justice until you see something that suggests different treatment to different patients. That's what it is. And he already had it early several times in the past without the pharmacy manager say anything. That's right. That's right. He also had it several times in the past. And probably other patients also had it several times in the past. So don't choose justice unless you see something that tells you patients are treated differently. In this case, when the manager said, oh, Mr. Craig is a long-time customer, he's VIP, please give him the medication. Yeah, the manager may say this about any other patient because the manager or the owner wants to keep the business. So be mindful of choosing justice here. There is no violation of justice because you can't really see any evidence that there is different treatment. So we give early refill to all patients. That's an assumption. That is not necessarily true. Justice doesn't mean to give early refills to all patients. Justice means to give early refills to those who need it. That's what justice is. And we'll have actually a very good discussion coming about this in a minute. For sure, not all the patients are VIP. For sure. And it is also for sure, Haya, that we may call all the patients VIP just to make them happy. When you go to a store and they tell you that you are VIP, you will be, oh, I'm important, even though it's your first time in the store. I think we have to be specific about the case, not overthink. Yes, yes. Don't try to read something that is not in the case. So when you tell me, see, the manager is violating justice because some patients are getting it and others are not. Sorry, just a second. Where did you see in the case that others are not VIP? Where did it say this in the case? Oh, it doesn't. Then it's not justice then. But if he says this is my relative, of course, that's a different story. If he says this is my relative, or if you know this is a relative of the manager, yeah, this can be different. If the patient says waive his co-payment amount and the pharmacist waive it off, but case doesn't say anything about other patients' co-payment, so justice is not violated. I will need to understand what the case talks about. Okay, but I have a patient who comes to the pharmacy and say, can I get this prescription filled? There is $10 co-payment on the prescription. So I tell the patient, there is $10 to pay. Patient said, no, I can't afford it. I don't have money. So I decide and say, you know what, sir, that's fine. I will waive the $10. Is this violation of justice? No. Why? Because there is nothing in the case that tells you that for other patients who can't afford, I will tell them, oh, if you don't pay the $10, I'm not giving you the drug. You can see that here. You can see it here. So we can't take it this way. Patient can't afford the co-payment. We told the patient, you know what, we will waive it. This is not violation of justice because there is nothing in the case that says that I did it only for this patient, but I refuse to do it for others. So we have to be careful. Exactly. Using the word VIP is a matter of loyalty here, not a matter of differential treatment. Yes, Mohammed. And again, I will keep saying the same thing. I'm sure some people listening to this, like, oh, no, this is all wrong. Everything he said today is wrong. That's fine. You have the right to think this way. There's no problem with it. But what I'm saying is not wrong, by the way. There's a difference between you have the right to think this way and I'm approving the claim that what I'm saying is wrong. No, it's not wrong. Just to make sure it's clear. I actually, during my sabbatical, I completed 2 courses for ethics for clinicians at Ryerson, which is now called the Toronto Metropolitan University. But yeah, because I was supposed to teach a course on ethics at another place. So I'm comfortable with what I'm saying. 17. So patient has a prescription for Biaxin 500. We typically call the physician and say, can we please switch it to 250, two tablets 250, because that 500 is not covered. This patient brings the prescription for 500, but when we see the prescription, it is coming from a physician that we don't like to talk to. So we tell the patient, you know what, here you go, that's the 500, and we get the patient to pay. So which ethical principle does the pharmacist violate by not calling the physician? That is fidelity. I'm supposed to do whatever the best for my patient, and the best for my patient is to get the drug for free, and I didn't do this. So this is fidelity. And what about beneficence? You cause the harm? Where's the harm? Where's the harm? Paying the full price, that's fidelity. That's the violation of fidelity. This is not harm. When you get the patient to pay for a service that otherwise you could help him with, that's fidelity. Yeah, and that's what we said. Fidelity is about the money and the business and things like that. What about beneficence? Yeah, harm is harm, like causing harm to the patient. So when you tell me the patient will have to pay, this is harm? No, I wouldn't accept this link between, if you pay, then I'm harming you. No. Otherwise, collecting co-payment from the patient will be harm, right? Then when the patient is supposed to pay $5 co-payment and they collect that, then I'm harming the patient. No. We can't make this link that paying money equals harm. No. So what about beneficence? Are we violating beneficence in this case? No, there is no violation of beneficence. Why? Because the patient is getting the drug. The problem is we're getting him to pay. So beneficence is not violated. Beneficence is not violated. He's actually getting what the physician prescribed, which is the Biaxin 500. What about veracity? What about veracity? No, there is no violation of veracity in this case. When will this be violation of veracity? If the patient asks me, when the patient comes to the counter and and the patient asks, oh, I have to pay $100, is there anything covered? And I'm like, no, unfortunately, there's nothing covered. Yeah, that's violation of veracity. You are put in a situation when truth is due. You're supposed to tell the patient, you know what? Yes, there is something else, but you provided wrong information. That's when you violate veracity. Okay? So I not fully understand fidelity. Fidelity is to do the best for your patient. Okay? And the best for anyone is to get something for free. I'm not kidding. To go to a store and you want to buy something for $10 and the staff tells you, you know what? Come tomorrow, it's buy one, get one free. Oh, thank you. That's a great thing. So fidelity is to do the best for your patient. One of the ways to do the best for your patient is to make it more affordable. So in this case, the pharmacist didn't want to make it more affordable to buy the drug for the patient, and that's why this is violation of fidelity. Do include monetary benefit in beneficence, then it becomes more fidelity. So saving the patient's money is more fidelity. That's why we said fidelity is more for business practice. 18. Isn't patient get benefited by not paying anything? Then we don't call it benefit. We call it best interest. Fidelity is to do whatever best for your patient. Okay? Part of doing the best for your patient is to save the money for the patient. So that's fidelity. That's where fidelity is coming from. But no, please, I wouldn't link beneficence to money. I wouldn't link beneficence to money. This is risky way of thinking, to be honest. This is the risky way of thinking when you translate the monetary benefits to beneficence. No, saving the patient money, getting the patient to pay less, giving the patient discount, this is fidelity, not beneficence. I'm not saying it's not important, but I wouldn't link it to beneficence. I would link it to fidelity. Next one. Actually, this is a case that I had myself. So I will tell you the story here. This lady, for a long time, used to get 60 milligram of temazepam, 2 capsules of 30 milligram at night for a long time. And then the physician was concerned about that she's using it for a long time. So the physician was like, you know what? Let's try to reduce the dose. So let's give her 30. But when you give 30, give 2 of the 15. So when the lady takes her pills at night, she still sees the 2 capsules because she's very stubborn about reducing the dose. And then the prescriber told us that he's trying to get the drug, trying to get the patient to stop the drug, but she refuses. So which ethical principle does the physician uphold in this case? Obviously, it is non-malfeasance. The patient is using the drug for a long time. The physician has a concern about, abuse and misuse and dependence. So the physician is trying to wean her off the drug, and this is non-malfeasance. So now someone will ask and say, but just a second, are we violating veracity here? Are we here violating veracity? No, I will not. Why? Okay, because basically we didn't provide any wrong information. We just changed the dose according to what the physician said. And instead of 2 capsules of 30, we are giving 2 of 15. When does this become violation of veracity? If the patient says, guys, I just noticed that the 2 capsules you put at night look different. And then we go, oh yeah, we are just using different generic. That's why. So it's the same drug. Don't worry about it. Yeah, that is violation of veracity, 100%. Physician uphold beneficence, pharmacist uphold fidelity, and violate veracity. No. Physician uphold non-malfeasance. Physician upholds non-malfeasance. Pharmacist uphold fidelity. No. Pharmacist here is not upholding fidelity. in this case. And not every case must have something upholding and something violating. You don't have to find something like this. Isn't this manipulation? No, you're not making any change to the patient's profile. The patient has a prescription for 30 milligram. You're just giving 2 of the 15 because you believe this way that's what the physician recommended, and we agree that we're trying to wane the patient of the medication. So is this manipulation? If I provide wrong information about this, maybe yes. But all what I'm doing is I'm dispensing the drug in a way that does not alarm the patient. Why not beneficence? When you reduce the dose we don't have anything here that says, first of all, reducing the dose doesn't work for benefit. You reduce the dose of a drug when? Generally speaking, when would you contact the doctor to reduce the drug dose? If the patient has side effects of the drug, or if you have concern that the patient is abusing the drug. So reducing the dose is always toward non-malfeasance rather than beneficence. You increase the dose more for beneficence. Why do you call the doctor and say patient should be on Ramipril 10, not 5, because the blood pressure is not controlled and you want to control the blood pressure? So typically, when you reduce the dose, you reduce it because of concern over adverse reactions or abuse. So that's hard. When you increase the dose, you increase it over concern of controlling the medical condition. So this will be benefit. So this is not beneficence, Duranj. Yes. Like follow the doctor recommendation or our ethics? That's your decision. So the question is, if this lady calls us today and the lady says, let me make sure there's no problem with the voice first here. Yeah, okay, there's nothing. Because when there are lots of messages, I'm worried it's voice messages. Okay, so the question is, if this lady calls the pharmacist today and says, these capsules look different. Now I'm in a position to tell the truth. What should I do? Should I tell the truth or shouldn't? This is based on your assessment of the situation. Why we are giving 30 without telling the lady? Because we are trying to get the lady off the benzo, because we have a concern of misuse or abuse or dependence, etc. Do you agree to this risk? Do you believe that the physician is doing this because there's a harm? Yes. Then in this case, you may choose to violate veracity and uphold non-malfeasance. And that's when you tell the lady, oh, that's just different generic, don't worry about it. Yes, I'm lying. But I'm lying because I want the lady to get off the benzo slowly, so I'm upholding non-malfeasance. Or I can decide and say, you know what, I don't care what the physician wants. Sorry, ma'am, your doctor reduced the dose. Now I'm upholding veracity, but I'm also causing a trouble on the other side because this lady may start taking 4 instead of 2, and so on. When we are tapering the drug, okay, so you are just making normal decision. Patient takes a drug, condition is controlled, and then you are just removing the drug. Is that like course of the treatment? Is that how the treatment is done? Like a drug you start with high dose and then you slowly discontinue the drug? That's probably just normal treatment course. That's probably beneficence, like just normal treatment course. You are following the treatment recommendations. Start with high dose and then start tapering after that. No autonomy. We are not telling the patient about the dose change. Well, again, no, again, autonomy has limits. So if we tell this lady, the doctor reduced the dose from 60 milligram to 30 milligram, the only thing the lady can do in this case is to say, I don't want it. Sure. In this case, that's up to you. That's exactly, that's even better because we want you to stop it altogether. So I don't see autonomy to be an issue here. So what did the pharmacist violate in this case? Pharmacist didn't violate anything in this case. The pharmacist didn't violate anything in this case. If you want to think of the pharmacist in this case violating, like if you want me to squeeze something just to make this, to answer your question, maybe fidelity. If I have to choose something, so what did the pharmacist violate in this case? And I have to choose an answer. Maybe fidelity. Why? It's about the trust. So when the patient takes the medication from you, and you know that the patient is expecting 60 milligram in the evening, and the patient takes 30, trusting that you gave me the right dose, this may be fidelity. But I'm here like really squeezing fidelity in this case. No, there's no violation of autonomy. Taking 30 milligram or 60 milligram is not up to you. This is not an option. When I go to the doctor and say, I need an antibiotic, and the physician tells me, okay, yeah, here you go, prescription for antibiotic for 7 days. 7, make them 10. Oh no, you only need 7 days. 10 will be okay just to make sure the infection is clear. No, the regimen is 7. Is the physician here violating autonomy because the physician doesn't want to give me these 3 extra days? No, it is not. Autonomy applies when the patient has the choice. Okay, so can we say that in order to violate veracity, patient has to ask first about a particular issue? In order to violate veracity, you will provide wrong information when you are supposed to provide the right one, or you will not be truthful. You don't tell the truth. That's when veracity becomes in violation. Veracity, Akash, doesn't mean tell everything you know. That's not what veracity means. When a wife comes to you and say, what does my husband take? And you tell the wife, go and speak to your husband, you are not violating veracity. Why? Because your job is not to just say, oh yeah, of course I have to apply veracity. Let me tell you. No, that is not true. But if you tell the wife, no, your husband doesn't take any medications, even though he does, that is violation of veracity. Now you are providing wrong information. But the case states that not to tell the patient about the dose change. Yeah, so that's part of the fidelity that I'm talking about. Patient to trust that you are giving me the right dose. So when you change the dose without telling me, you are violating. I trust you that you put the 60 milligram at night, so now you are making them 30. In any case, dose is determined by the physician. Exactly. Veracity is not violated. Question mark, can I understand more? Because you did not provide wrong information. Veracity is not to volunteer information. Veracity is to tell the truth when there is a question. So when this lady, repeating guys again, and that's why probably we should keep going forward after this. If this lady calls the pharmacy and say, why my capsules in the evening are different, and I say, because we are using different generic, now I am violating veracity. I am lying. I am providing wrong information. Veracity, repeat again, doesn't mean to volunteer information. Veracity means you provide wrong information when you are supposed to provide the wrong information. My concern now is the lady might lose her trust in other healthcare professionals when she gets more insomnia afterward. That's a problem. Yes, you're right. This lady may have a problem sleeping and may question that. Yes, you're right. After dosage change, lady complains she can't fall asleep or drug is not working for her anymore. Do we disclose then to her the dosage change? You can. If she calls you and say, why all of a sudden I can't sleep? I will tell her, you know what, you probably should talk to your doctor about this first. That's my first choice. If the lady says, oh, you know what, since you guys switched it to this different generic that you told me about, I have a problem falling asleep. So what's the problem? Can you put me on the same medications again? You know what, why don't you talk to your physician about that you can't fall asleep? This would be my first choice. Isn't hiding information a violation? Depends on what you're talking about. It depends on the case. Hiding information when you are supposed to give the information is violation. Guys, we took too much of our time today. Hiding information when you are supposed to provide the information is violation. If this lady says why the capsules are different, repeat again. You are supposed here to not hide the information. If you do, then that's a problem. But when the wife comes to you and say what my husband takes, hiding the information is not violation. So again, hiding information is violation. It's violation if you are supposed to share the information. But if you are not supposed to share the information, then it is not a violation. Okay, I think we will need to keep going forward because this is taking too much of the time and we keep repeating ourselves over and over. I try to discuss it because it's the same case, so it's nice to have a discussion. But if I feel that we keep dragging and we keep repeating ourselves, maybe it's a good idea to keep moving forward. So, but he refuses to decrease the dose. So now we are violating autonomy. Repeat again. So that's what I say by we are repeating ourselves. Autonomy doesn't apply until you have a choice. So repeat again, Haya. If I go to the doctor and the doctor gives me 7 days supply of amoxicillin, and I say no, 7 days are not enough, give me 10, and the physician says no. Is this violation of autonomy? No, it's not. I go to my doctor today and my doctor tells me your blood pressure is controlling because you are losing weight. So let's change your Ramipril from 10 to 5. Okay? And I go, no, I want the 10. Yeah, but your blood pressure is getting lower. You will be in trouble. Oh, no, I want the 10. Now the physician decides to give me 5. Ignoring what I said. Is the physician here ignoring my autonomy? No. Deciding the dose of my blood pressure medication is not autonomy. Deciding the dose of my benzo is not autonomy. Okay? Autonomy applies when I have the choice. If the patient fights when he comes to know the pharmacist didn't update the... Okay, if the patient fights when it comes to know the pharmacist did not update him during pickup, how to handle? Well, you need to explain to the patient why you didn't do it, and if it's a mistake, you apologize. If he disclosed the truth, she will try 4 capsules at bedtime. It's a possibility. So maybe the doctor is violating. There's something wrong going on by treating the patient in a way that he doesn't want or know. That's autonomy. That's the patient. Sorry, this is fidelity. When you need to discuss with the patient. Patient comes to you trusting you are giving the right drug. I actually mean hiding information about the patient himself or herself is not a violation. Hiding information about the patient himself or herself is not a violation. It's a violation and it's not a violation, depending on what you do. Are you lying for the sake of lying? We will keep going after this, guys. Are you lying for the sake of lying or are you lying for something else? If you're lying for the sake of lying, that's too bad. But if you're hiding the information, as we did with the guy who had cancer, and we told him this is a multivitamin, to make sure he takes the drug, then you are violating something to uphold something. Oh, this case is already answered. 19. Which ethical principle does the pharmacist violate when refusing to inform a cancer patient about his or her short life expectancy? This is someone who comes to you with a lab report and tell you, can you please read this for me? And you tell him after you read the report, it says that this patient has short life expectancy. So you return the lab report back to the patient and say, sir, you know what? You probably should talk to your doctor about this. Yeah, of course I will talk to my doctor. I just need to know what's in the report. You know what, sir? It has lots of medical terminology. Your doctor will be the best one to explain that to you. I don't want to be the bearer of the bad news. So that's about autonomy, not veracity. Oh my God, not veracity. I didn't provide wrong information. I didn't tell the patient, oh, this report says you are healthy and you will live 100 years. That's when I violate veracity. Veracity is when you provide wrong information when right information is due. Okay? Why not fidelity? I didn't break the patient's trust. I didn't say anything wrong. I didn't do anything wrong. I told the patient, you know what, sir? Take it back to your physician. There's nothing wrong with that. Of the autonomy of coming to you to read it. I want you to read this for me. So you will say, no, I'm not going to read it for you. That's basically what happened in this case. I'm coming to you and say, can you please read this for me? And you tell me, you know what? No, you go to your doctor to read it for you. That's the only scene of autonomy. What does he have to choose? He chose you to read it. That's his choice. He feels comfortable that you read the report. So when you say no, go to your doctor. The patient is coming to you to read the report. Hiding the information is driving us crazy. It's a misconception about veracity. That veracity means tell everything you know. That is not true. Why autonomy? He has no choice. No, he has a choice. I have a choice to come to you as a pharmacist and say, can you please read this for me? Reading the report is a choice. Choosing your pharmacy is autonomy. I come to your pharmacy. I didn't go to your neighbor. Okay. So case doesn't say anything about report. Yeah, to inform the patient. That's why I told you the case. The patient comes with a report and says, can you please read this for me? That's what I said in my explanation of the case. So I said to the patient, the pharmacist said, you know what? You should take this report back to your physician. The patient said, sure, but I want you to read it for me first. And then I tell the patient, you know what? It has lots of medical jargons. Your physician will be the best one to interpret that. So that's where the report is coming from. I told you to do the report. What time is it? Oh, it's time for lunch. So let's be back at 4:25. 4:25.